Black fungus infection spike across India. 8,848 black fungus cases, 126 deaths. The key drugs used to treat this now unavailable in many parts of India. The government gives licenses to 5 more companies to manufacture this key antifungal drug. The Congress's Sonia Gandhi writes to the Prime Minister about the black fungus drug shortage, says immediate action must be taken to ensure supplies. Delhi reports the lowest daily cases since the 31st of March. The positivity rate dips to 3.58%, but the national capital has run out of vaccines. No vaccines to be administered to the 18 to 44 age group from Sunday. A total lockdown in Tamil Nadu without relaxations for a week from the 24th of May. Only pharmacies, milk shops and newspaper vendors allowed to operate. Mobile outlets to supply fruit and vegetables through local bodies. A reality check at the healthcare facilities in rural UP. This even as residents die due to a shortage of medical assistance and oxygen. Trekking through mountains to administer vaccinations from door to door in the border villages near the line of control in Jammu and Kashmir. A special report. A multi-faith group that helps provide dignity in death for loved ones in the midst of a global pandemic. The top story at this hour: after remdesivir and medical oxygen, SOSs are now being heard for amphotericin B, the drug that treats mucormycosis, the rare fungal disease hitting patients recovering from the coronavirus. Over 8,800 cases of the deadly infection have been detected in India so far, and states have begun treating this as a notifiable disease now. A notifiable disease means the centre has to be mandatorily informed about any case that is detected, as is the case for TB, cholera and diphtheria, for example. Ironically, the black fungus cases have been brought on primarily by the misuse of one of the proven therapies that help severe COVID patients escape death: steroids.
Mucormycosis, dubbed black fungus, declared as a notified disease under the Epidemic Diseases Act by many states, is the new cause of concern, as several thousand COVID patients across India have been infected with this deadly and aggressive fungal infection. India accounts for 71% of the total black fungus cases worldwide.
The reason why it's being reported more in India, I think, is multifactorial. One is that we continue to be the diabetic capital of the world. So we have a large number of people who have underlying diabetes, and many of them have a very poor control of diabetes because of multiple reasons. Secondly, we know that COVID-19 itself causes a high chance of this fungal infection because it decreases your lymphocyte count, and therefore people who have COVID-19 are more prone to getting this fungal infection. And the third important reason is the off-label or over-the-counter use of steroids.
8,848 patients have been infected with the black fungus across the country. Gujarat tops the list with 2,281 mucormycosis cases. Maharashtra has 2,000 patients fighting this rare fungal infection. Andhra Pradesh has reported 910 cases of mucormycosis.
वही डायबिटीज अच्छा वेल कंट्रोल्ड है और कोविड होगा तो संभल जाएगा, ब्लैक फंगस भी नहीं होगा और मोर्बिडिटी भी, मोर्टेलिटी भी कम हो जाएगी। वेल कंट्रोल्ड, वही अनकंट्रोल्ड है अगर तो नुकसान हो सकता है।
Unfortunately, while there is a rapid rise in black fungus cases reported across India, this is matched with a reported acute shortage of liposomal amphotericin B, the medicine prescribed for the treatment of this deadly fungal infection.
उससे संबंधित एम्फोटेरिसिन बी जो कि एक एंटी फंगल ड्रग है, जो देश में लिमिटेड सप्लाई में शुरू में अवेलेबल थी, उसको बढ़ाया जा रहा है, जिसके लिए दो तरीके से एफर्ट किए जा रहे हैं कि कैसे हम सप्लाई को बढ़ाएं और कैसे उसकी अवेलेबिलिटी को और फर्दर बढ़ाने के काम करें, जिसके तहत 5 एडिशनल मैन्युफैक्चरर्स को देश में लाइसेंस दिलवाने का कार्य मिनिस्ट्री ऑफ फार्मा, मिनिस्ट्री ऑफ हेल्थ कोऑर्डिनेशन से कर रही है।
The center now says steps have been taken to increase the availability of the antifungal drug.
23 out of 36 states and union territories have reported black fungus cases. Though it is not contagious, health experts say misuse of steroids resulting in this deadly fungal infection. With camera person Manu Nair, this is Arvind Gunasekar for NDTV.
And this is India recorded 2.57 lakh fresh COVID cases and 4,194 deaths in the last 24 hours. As per the government, the overall number of cases across the country has been declining for the last 15 days. The positivity rate, the government says, also has been consistently declining, and according to the government, it is nearly half as it was compared to the 10th of May. Maharashtra has also reported 26,133 new COVID cases, which is the lowest tally since the 19th of March. 682 deaths, though, have been reported in the last 24 hours. The positivity rate in this state has dipped to 16.97, the recovery rate at 92.04%. And Delhi, the national capital, has reported the lowest daily cases since the 31st of March. The positivity rate has dipped to 3.58%. But the national capital has run out of vaccines, and no vaccines are to be administered for the age group of 18 to 44 years of age from Sunday, that's tomorrow.
इसके लिए केंद्र सरकार को मेरे 4 सुझाव हैं। पहला, भारतीय बायोटेक कंपनी जो कोवैक्सीन बनाती है, वो अपनी वैक्सीन का फॉर्मूला दूसरी कंपनियों को देने को तैयार हो गई है। जितनी विदेशी वैक्सीन है उनको भारत में इस्तेमाल करने की तुरंत इजाजत दी जाए, ये भी 24 घंटे में होना चाहिए, इसमें भी बिल्कुल देरी ना की जाए। और विदेशी वैक्सीन के जितने निर्माता हैं उनसे भारत सरकार बात करे। अभी भारत सरकार ने राज्यों पे छोड़ दिया कि स्टेट्स बात करें, हर राज्य अपने अपने स्तर पे विदेशी कंपनी वालों से बात करे। ये कोई अच्छा लगता है? कुछ देश ऐसे हैं, पढ़ने में आ रहा है मीडिया में, कि जिन्होंने जरूरत से ज्यादा वैक्सीन जमा कर रखी है। उनकी जनसंख्या जितनी है उसके हिसाब से उनको जितनी वैक्सीन चाहिए उससे कहीं ज्यादा वैक्सीन वो स्टोर करके बैठे हैं। उनसे भारत सरकार को वैक्सीन लेने के लिए गुजारिश करनी चाहिए, प्रार्थना करनी चाहिए। और चौथा सुझाव, ये जितने विदेशी कंपनियां वैक्सीन उत्पादक हैं उन्हें भारत में वैक्सीन उत्पादन करने की भी तुरंत अनुमति दी जाए।
And the Delhi Chief Minister also provided financial assistance of 1 crore rupees to the family of a late corona warrior, as he called him, Dr. Anas Mujahid. Dr. Mujahid, a junior resident doctor at the Department of Obstetrics and Gynecology at Delhi's GTB hospital, died of COVID-19 on the 9th of May, just one day after he contracted the virus. The Chief Minister tweeted, late Dr. Anas was hardworking and served the people of Delhi at the GTB hospital since the time corona emerged in the capital. Many corona warriors like Dr. Anas are on the front line helping the people of Delhi, and it is because of people like Dr. Anas that we are able to save lives, and the Delhi government has been able to fight the corona pandemic, said the Chief Minister in a statement. The Chief Minister visited the family of this doctor and handed the family the financial support worth 1 crore rupees. Meanwhile, vaccinators are trekking for miles through hills and valleys to administer vaccines to those along the line of control in Jammu and Kashmir.
Door-to-door vaccinations in border villages near the line of control in Jammu and Kashmir. Trekking through mountains, vaccinators in Buniyar block have vaccinated almost 100% of those above the age of 45. Most of the villagers near the LOC have no internet access, and online registration is not possible here.
Population is more than 80,000 in Block Buniyar. It is all scattered and hilly, and it is very difficult. The most of the area touches the LOC, and 60% of population is without internet facility. So To overcome these difficulties, we have decided and we started out a program for door-to-door campaign.
Kashmir may be facing severe vaccine shortage, but this border area has achieved 98% vaccination of first dose for the age group of above 45. And what are they doing, the health officials? They are going door to door in these remote hilly areas.
Between them, Umar Shakil and Ishfaq have administered over 10,000 vaccination doses.
मैंने अभी तक 4,000 वैक्सीन किए हैं। कैसे कर रहे हैं? हर दिन जाते हैं? जी सर, हर दिन हमारी टीम निकलती है बोनियार से, 2 टीमें निकलती हैं। मोबिलाइजेशन किया जाता है टीम को, फिर निकलते हैं सर, हमारे साथ डॉक्टर साहब होते हैं। आपके साथ है ये कितनी वैक्सीन? हाँ जी जी। तो आप बताएंगे कि आपका नाम, आपने कितने किए हैं वैक्सीन अभी तक? इशफाक जी
6,000 वैक्सीनेशन खुद किए हैं, डोर टू डोर सेक्शन हमने किए हैं, डोर टू डोर जाके।
But what is the challenge? Those who have already taken the jab, some have taken jab more than 3 months back, they are waiting for the second dose.
For more than 2 weeks now, most vaccination centers in Kashmir have completely run out of doses, while the government claims that fresh supplies have reached the valley and that vaccination has resumed 3 days ago. The pace of vaccinations is abysmal, with only 2,500 doses administered across 10 districts in the valley per day.
मैंने 19 फेब को करवाया है और आज तक मैंने 2-3 चक्कर जो हैं काटे हैं पीएचसी अपनी के, ताकि मैं सेकंड डोज करवाऊं, लेकिन अभी तक नहीं पहुंचा है। जिन्होंने भी मेरे साथ करवाया है 19 फरवरी को सर, वो सभी इंतजार में हैं।
Vaccine supplies to Kashmir are slow, leading to uncertainty and cynicism among the population eligible for vaccination. Inadequate vaccine supply has overshadowed the work of vaccinators in border areas who trekked for miles to safeguard citizens against COVID. With Nazir Masoodi in Boniar, Rohit Wellington for NDTV.
And daily COVID cases, the reported ones at least, may be coming down across India, but it's still a huge worry in rural areas, as NDTV's Kamal Khan found out as he visited a village in Unnao in UP, where public health centers remain closed, despite 20 deaths being reported in this village in the last month. Here's a reality check on the systems in place to fight this raging pandemic in rural UP.
Ravindra is suffering from cold and fever. He has come to a public health center at Kanjora village in Unnao district. But the center is shut. He says it's been like this for months.
लेकिन यहाँ कोई है ही नहीं, ताला बंद है, महीनों से नहीं आ रहे हैं, तो आज सोचा कि हो सकता है आ गए हों, क्योंकि इससे पहले शिकायतें की जा चुकी हैं, लेकिन यहाँ कोई आया नहीं।
The mother and child care center in this village is also closed. There are bushes growing everywhere. In one of the rooms, a cat is resting on a stretcher. On the wall of the mother and child care center is a poster in which the facilities for pregnant women are depicted. But villagers say it must have opened for a few days when it was built. However, it has been closed ever since. This notice says that if any staffer at this center asks for a bribe, call on the toll-free number.
यहाँ लिखा है कि घूस मांगने पे उसकी शिकायत करें, तो ऐसी कोई समस्या तो नहीं है?
समस्या साहब यहाँ कोई आता ही नहीं है, क्या घूस जो है ताला और दीवार मांगेगी, ये कोई आता ही नहीं है।
Bhaiya Lal's family narrates how when he fell ill, they ran from pillar to post for his treatment, but he could not recover.
2 डॉक्टरों की दवाई यहाँ करवाया पावा में, वहाँ से कोई फायदा नहीं हुआ। फिर एक डॉक्टर बरबटपुर के पास किन्ना है, वहाँ करवाया, वहाँ भी कोई फायदा नहीं हुआ, उसके बाद वो गुजर गए।
It's the same story in this household. Kamal's grandmother had fever. With no medical facilities in the village, the family had to go far to fetch medicines. There was no corona test done. Ultimately, she died.
दादी को हमारे बुखार था और 3-4 डॉक्टरों को दिखाया गया था। गांव के अस्पताल हमारा बंद था, इसलिए बाहर से हम लोग दवा ला रहे थे।
लेकिन बची नहीं?
नहीं बची नहीं।
कोरोना का टेस्ट हुआ था?
कोरोना का टेस्ट नहीं हुआ था।
The village pradhan says that about 20,000 people of nearby areas are dependent on this public health care center. There have been 20 deaths here in the last 1 month, he says. But the PHC has remained shut.
ताला बंद है तो लोग झोला छाप डॉक्टर दवा करा लेते हैं। अगर आराम नहीं मिला, बहुत दिक्कत ज़्यादा बढ़ गई,
तो फिर प्राइवेट नर्सिंग होम जाते हैं, उन्नाव या कानपुर.
When there's a raging pandemic, deaths in the villages due to COVID symptoms and closed healthcare centers are a dangerous sign. With Kamal Khan in Unnao, Bureau Report, NDTV.
And the number of COVID cases in both Karnataka and Bangalore have dipped slightly in the last 24 hours, but the number of deaths have increased, with Karnataka reporting just over 31,000 cases and 451 deaths, and Bangalore reporting 8,214 cases and 200 deaths in the last 24 hours. And as millions of Indians struggle to say goodbye to loved ones who've succumbed to the coronavirus, what of those family members who are positive and cannot attend to the last rites? Well, in Bangalore, a group of volunteers from different faiths have banded together with a simple 3-word message to nourish your soul.
Nicole is a social work student. Her cousin, Tina Cherian, is a final year medical student. These young women now spend hours a day inside a cemetery in Bengaluru.
It makes me feel very nice to be able to help, and I have a lot of love in my family and our family, and that helps us get through it with seeing the number of bodies and stuff every day. But we're surrounded by so much happiness at home that it makes up for it. And I don't think there's any difference us being girls and all of that. People have been asking, and yes, we are young in that sense, but if not now, then when?
Ambulance comes to the gate, and then we help in transporting the body to the grave. Either in the stretcher or in the coffin itself, and then we help in lowering the body into the grave, and then we leave. And if they require prayer service, we have a few fathers, and so they do the prayer services, and then we leave. And it makes us feel it makes it very fulfilling, because these families have no one to help them.
With many deaths recorded in the city due to COVID-19, the group, Here I Am, has helped with over 1,400 burials since the first wave, including over 800 in the last month alone during the deadly second wave.
We have almost 60 to 70 volunteers who have been divided into 4 zones, and in each cemeteries of dividing the Bangalore into 4 zones, we have placed them, and they are volunteering for the packing of the bodies, especially collecting the body from the hospitals, and also if somebody who have died at home, we try to go and pack the bodies and get them to the cemetery. And we are also providing free service of ambulance, and also if somebody very poor, we are trying to give them the coffin boxes, and also for the diggers also we pay for that. We give a consolation to the family in this time of distress that we are there with you, and to reduce the burden of their, because most of the family members, sometimes when the beloved person members pass away, even they are also found positive, and the thing is that they will not be able to come out of their house, and they do not know how to organize for the burial. So we take up the responsibility of doing all the required things and give them a decent burial, so that the family members also be satisfied with that.
To train the volunteers, the group looked at the work of Mercy Angels, another city-based group helping with COVID funerals.
We've given almost 120 training program for the volunteers. Different people are given how to use even a PPT kit, how to touch the body, and how to keep the distance and things like that. So this is how we started, and we kept the name Here I Am. We have a centralized number, and there is no only for the Christian. Anybody can call up this number.
Working hard to live up to the motto of Here I Am. To have a dignified life is a basic human right. So is having a dignified death. With DM Kumar, Maya Sharma in Bengaluru for NDTV.
Welcome back. News from around the country now. And weeks after the Congress faced a crushing defeat in Kerala, the party has chosen V.D. Satheesan as the new leader of the opposition in a significant move. The party High Command's decision to select the 56-year-old leader for the post seems to signal a major shift in its functioning within the state. Sneha Merikoshi has this report.
56-year-old V.D. Satheesan, the new leader of opposition chosen by Congress High Command over 65-year-old Ramesh Chennithala, weeks after Congress's crushing defeat in Kerala Assembly elections. A decision after several Congress parliamentarians, legislators proposed V.D. Satheesan and demanded an organizational revamp across Congress leadership in Kerala.
We received a
great setback in the last assembly elections. So the entire congressmen and the UDF men are demanding for a change for generation shift. They demanded for that. The members of the CLP and the MPs from Kerala and other UDF leaders also demanded for a change. We are not accusing the leadership, the present leadership. They are also, we are expecting assistance and blessings from the present leadership also. But this is a challenging position. We have to change the entire workers of the UDF are demoralized. Then we have to give them a hope, a confidence. And we are very confident that we can come back like thunder and lightning.
This decision seems to be a snub against the clout behind group factionalism between Ramesh Chennithala and Oommen Chandy-led factions, even though the two groups joined hands in support of Ramesh Chennithala as the opposition leader. V.D. Satishan is a 5-time MLA from Paravur in Ernakulam. He was once part of the Chennithala faction but worked his way against Chandy-Chennithala group factionalism over last 2 years. Satishan has his tasks cut out. He not only has to bridge the factionalism within the party and present a united front, but also take on the left government, which is returning with a huge mandate when the assembly session starts on Monday. Sneha Koshi for NDTV.
And that's the news at this hour. Bye-bye.